Hi, I'm Lori Schulman, and today we're going to be talking about what to expect when you start using iNAP. Before you start using iNAP, we'd like to discuss what therapy may be like for you when you start using it, particularly over the first 2 or 3 weeks. Anytime we introduce something new to our nighttime routines, it can take some time to get used to. Think about when you started using a new pillow or you purchased a new mattress and how many days it took for you to feel comfortable. While iNAP is very comfortable, acclimation to an oral interface can take some time, anywhere from a few days to a few weeks. And it takes time for your brain and your subconscious to get used to having a new object in your mouth. Some people report that they may salivate a bit more when they start using iNAP, but we know that this will subside once they become used to the therapy. Here's a few things to keep in mind when you start. We recommend that you give yourself enough time to get used to the oral interface while you're awake. For example, an hour or two before you go to sleep, while you may be sitting and reading, practice wearing the oral interface. And after this, try using the oral interface with the device attached and creating that negative pressure. You'll learn how to create what we call a seal. And seal time means that you're having the therapy, the appropriate negative pressure in your mouth, bringing that soft tissue forward and stabilizing the tongue. So practicing this is important so you feel comfortable and that your mouth gets used to it. Don't expect you're going to be able to use the device right away the first night you get it. It will take time to build up to being able to use it all night. Some people find that it takes a few days, some people a little longer, but if you're motivated to use this, then doing these short stints of increasing time is what we find most helpful. Some people may find that they have a little bit more salivation when they wear the oral interface, especially when they're awake. But once asleep, that salivation should subside. iNAP does a really good job of moving that excess salivation from the mouth into the saliva container. So increasing wear time a little bit each night can make a huge difference in long-term success. Another idea we have is to place the device in bed with you. So rather than keeping it on the side of your bed like you may have done in the past, put the iNAP above your head, like between your pillow and your headboard. That's a good place for it. Or you can put it down by your hip. Turning the device over so that any of the indicator lights are hidden is best for you and your bed partner. And don't be afraid to ask questions. We're here to help and support you as you learn how to use iNAP and you're trying to achieve better sleep. So remember that anytime you introduce something new into your nighttime routine, it can take your body time to get used to it. So with time and practice, the seal time should improve and the length of time you're able to wear the iNAP should get longer and you should start to feel more rested with iNAP. We're excited for you to start this journey with us. Good luck. So in the box that we sent to you, you would have received the device, which is this. Also the mouthpiece, the tubing, and a pack of dry pads, right? Those are going to be the essentials that you'll use every night. You also would have received a power cord to charge it. The device comes to you with some battery in it. We always suggest that you top it off and add more battery to your device so that you have a full charge that should last you 6 or 7 nights in a row, which is great if you're traveling and don't want to take the power cord with you. When you have the device, you'll notice that there's a lid. Go ahead and pop that off. There's an O-ring which creates an excellent seal at the top. And then you'll see this pointy part here, and we're going to go over that in just a second. Inside, we're going to place what's called a dry pad, and that is what absorbs any excess saliva that may be pulled through the system. On the bottom part of the iNAP is the motor, and that is what creates the pump that is the negative pressure that helps stabilize the tongue and pull the soft tissue forward so that you're able to breathe easily at night. When you get your dry pads, go ahead and open one of those up. You'll notice there's a perforation at the top. Go ahead and tear that open, just like that. You'll be able to notice that there's a cellophane seal around it, what keeps everything dry inside that saliva container. And also, if you squeeze it, that will be where all the absorbent material is that will absorb any excess saliva. We're going to take this and pop it into the top of the saliva container. Take the top of your lid and go ahead and put that pointy part directly into that dry pad right in there, so that it goes right in there. And then you'll click this down. Once you hear the click, you know that you've got a good seal. The next thing you're going to do is, once you've taken every component out of the boxes, you're going to take the tubing. This is about a 3-foot long tube, and this goes between the device and the mouthpiece. The gray end is what you'll insert into the top of your saliva container. And you'll hear that click in place as well. At the other end of the tubing is where you will attach the mouthpiece. So you'll take your mouthpiece out of the box, and you'll notice that the mouthpiece looks like it's a cross between, I like to think of it as a baby's pacifier as well as a snorkel. And you wear it like a snorkel because the soft flange here will go into your mouth between your lips and your front teeth. And there's also a smaller flap here, and that will be placed on the inside of your bottom teeth. And that helps secure the mouthpiece in place so it doesn't move. And when you attach this, you have to line it up because it's not a perfect circle on either end. It's a little bit oval, so you want to be sure that you line that up and then push that into place so it's secure. All right, now you've got everything connected, and we're going to talk about next how to turn it on. So if you press this button and hold it for about 2 or 3 seconds, all the lights will turn on. And now we have the green light on and the blue light on. The green light is the power for the battery, showing that's got enough power to make it work. And then where you see a little fan icon, that is the pump. And the pump is actually working right now to create negative pressure. Once you put this in your mouth, that blue light, when it's flashing, will go off. It may be hard to see that it's blue here, but trust me, it's blue. And you'll put that inside your mouth, and then when you swallow with this in place and center it with your lips closed around the mouthpiece, it will go off, and that will show that the negative pressure is creating a seal inside your mouth and doing what it's supposed to do, which is to bring the soft tissue forward and create that space in the airway. When you turn it off, you hold it also for 2 or 3 seconds, and all of the indicator lights will turn off. When you charge it, on the very bottom, you'll notice that there's a little flap that opens up like that, and it's a regular USB charger. You can use the one we sent you. If you have another one around the house, you can use that as well. All right, now we're ready to go. When this is used in bed, what we recommend is that you acclimate to it. And what that means is that, like anything new to your nighttime routine, you want to take time to get used to having something new in your mouth. Like anything new, whether you get a mouth guard or glasses, those are things that take time for your body to get used to. Subconsciously, when you're using this, your mouth will know what to do. And over a few days, it becomes second nature, and you'll know where your tongue should be. So initially, we expect it won't be that easy, but we do expect that over a period of time, you'll get used to it and it'll be easy to use. When you put this in your mouth, as I mentioned, the way this works is that on the flap, on the mouthpiece, this stem is where the negative pressure is coming through. So in other words, it's drawing, it's not blowing anything into the airway, it's pulling out from your mouth. So it's pulling the saliva, which potentially can go through, and the excess saliva that you might have will go through the tube here and through the mouthpiece, through the tubing, and get deposited into the device. When you find this that sweet spot where it's supposed to be in your mouth and you're able to keep your lips comfortably closed around it, it will be working, and you should feel a little bit of suction or vacuum inside your mouth. But it should not be uncomfortable. It should be very comfortable. And if not, you may need to move it around a little bit. Some people find they have excessive salivation when they use the iNAP, and that goes away in time. Just again, it's the mouth trying to get used to having something foreign in the mouth as part of your normal nighttime routine. So the idea is to acclimate, and when we talk about that, the idea is that you want to be able to use it before you go to sleep, before you're actually in bed. So what you'll try to do is while you're awake, when you're sitting around in the evening, either reading, watching TV, any of those quiet activities, ideally you have this in, and you can also have the device turned on while you're using it, just to get a sense as to what that negative pressure feels like. Some people start with just trying the mouthpiece and walking around the house with this in their mouth, doing what they normally do, or sitting at their desk. You can use this just to get used to it, doing other things. It'll just look like a little white piece sticking out of your mouth, but it's very discreet. When you feel like you can use it to go to sleep, go ahead and turn it on. To turn on the device at night, all you do is you hold this button in, and that will turn the device on for you. If an orange light should turn on, don't worry about that. That means one of two things. The most common reason would be that the saliva container is full, but that is usually not what we're seeing right now. So if the orange light goes on, it just means that the device is detecting that there's too much negative pressure, and it will just let you know that there's higher negative pressure than it's set for. But it doesn't mean it's not being therapeutic. So if you don't want to see the orange light, right now we're instructing our users to just turn off the device, hold it for 2 or 3 seconds, and it will reset, and that orange light will go off. So then you could try again, and it should turn on again. We also should talk about cleaning. So cleaning the device is very simple. It takes maybe a minute in the morning. So what you want to do is take everything apart by the sink, detach the mouthpiece, detach the tubing from the top of the lid, open up the lid, and turn this upside down and throw away the dry pad into the trash can. You won't need to use that again. You're going to use a fresh one every night. And by the sink, when you're at the sink, go ahead and run the mouthpiece under cold water, rub it between your fingers so that it's no longer slippery. If it still feels slippery, that means there's some saliva still on the mouthpiece, and you want to be sure you run water through the opening of the stem all the way through the other smaller end. Or you can try running the water the other way. Just be sure that this no longer feels slippery. And then you want to run cold running water through the opening of the tubing and have it run out the other end. And then you want to be sure that there's no water droplets left inside. So you want to blow through one end to force some of that excess water out the other end. As I mentioned, that saliva, this dry pad will keep the saliva container dry. This should be totally dry in the morning. What you can do is detach the device. You'll notice that there's a button on both sides of the device. If you press those at the same time, when the device is turned off, it will detach the saliva container. You just push those at the same time and this will pop right off. You can rinse this with water if you like, and be sure it's air dried, or to air dry it. And then at night when you're ready to put it back together, you can go ahead and do that. This should be dry. When you put it back together again, you want to be sure that everything is aligned, and it will click back in place. Okay.
Hello, my name is Olivier, and I will show you how to pair the iNAP device with your phone, whether it's an iPhone or an Android. So the first thing you want to do is to download the iNAP Lab Plus app from either iTunes or the Android store. And you will see on this video the logo that you want to look for. Be careful, there's another app called iNAP Care. This is not the one you want to download. Once you're ready with the downloading the app, you just open the app and I will share that on the screen. So when you open the app, this is a screen that you will see. You will see the date on the top, and you will see 4 boxes. One is result, one is called device, one is factors, and one is compliance. So at that point, I want you to turn on your iNAP by pushing the button for a few seconds until you see the blue light flashing. And then you will click on your app on device. Then the list is empty because we haven't paired any device yet, but I want you to click on the plus, orange plus button at the bottom, and then choose iNAP Sleep Therapy. And now make sure that your device is on, and you will see you have 2 stickers, one at the top and one at the bottom. I want you to locate on the bottom the QR code, which is square with black and white dots. Now you click scan QR code, and then you will take a picture of that QR code until pairing is successful. So at that point, you click continue, and you can see the device with a blue light and some numbers that correspond to actually the vacuum that's exercised by the pump. You can also see that on my device, the battery is almost empty, and it's time for me to recharge it. Click on home. And at that point, you can turn off your iNAP by pressing the button. Let me show a little bit the type of data you get. So what the app does is every morning when you wake up, you will upload the data that was registered during the night. So you will turn on your device, and then if you have data, the compliance download box will be activated, and you just have to click on that box. Now, if you click on results, you will see what were the different parameters of your last night. So you can see that I used it for 7.2 hours, and I had a seal time for 4.5 hours, which is 74%. Now, I didn't do a good job with the seal time, as a patient, you would like to be at least at 85% or above, but we'll talk about that in a different video. You will see hours by hours, the treatment time, which is how long the device was powered on. And then next to each is a blue bar, is a seal time. So what percentage of that treatment time did you have a good seal? And a good seal, that means that the device detects that you're reaching the threshold of negative pressures that is expected. So you can see hours by hours how well you did. If you click on the top right of the result, you can see actually all the different nights where you used it and how good you did in terms of seal time. You can also click on trends in week. So you can see week by week your seal time and treatment time. And if you click on more at the bottom, you can see a lot of tutorial on the device. So you have the quick start guide that you have received together with your iNAP, but you also click on videos with a number of videos on how to use a device, how to clean it. That concludes that presentation. Hopefully you were able to pair your device and start using it and collect those very valuable data. Anyways, if you have any question, do not hesitate to contact us directly at this email address or the phone numbers that you can see on that screen. Thank you, and we wish you a great quality of sleep.